Like many parents, Mike and Kristen Wallace are very involved in their children's lives.
Life's pretty busy, two almost teenage girls, and we're just constantly going in different directions. I mean, the girls are in sports and
getting them to track or show choir, swim, cross country, softball, piano lessons, Girl Scouts.
Mike is also very involved as president and CEO for Fort Healthcare.
I really enjoy leadership, trying to further the mission and vision of Fort Healthcare, get to work with a lot of talented employees. I think we enjoy great community support.
However, the Wallace's family life changed dramatically one day while Mike was at work.
I was sitting in the boardroom and just was kind of pondering a question or a thought, and I felt kind of an enlarged lump on my neck.
I guess we kind of wrote it off a little bit. He'd had dental work done, and we thought, well, he probably has some kind of infection.
Went and saw an ENT physician, had him take a look at it, and he didn't seem overly concerned, but thought it was something we needed to keep an eye on and prescribe some antibiotics.
At first, the lump didn't seem to be a big deal, but when antibiotics didn't take care of it, they decided to take a needle biopsy to check for cancer. That time in between the tests and the diagnosis was very difficult.
Just waiting and hoping and praying that it's nothing, but having a sick sense that maybe it is.
After several tests, it turned out to be a rare form of cancer. At one point, the couple admitted that dealing with the news was very challenging.
When I did get the final diagnosis that it was positive for T-cell lymphoma, that was hard.
I was angry. I'm thinking, here's a guy that is the picture of health. I mean, he eats right, he exercises. I don't get it. I mean, why should this be something he's got to deal with? It doesn't make any sense to me.
While others would be defeated by such news, surrender was not in the Wallace family dictionary.
While I'm disappointed and it hurt to discover that I did have cancer, I was thankful that the lymph node swelled up on my neck, wasn't buried in my stomach where I couldn't see it. They were able to catch this and stage it as a stage 1 cancer.
Mike is an extremely optimistic person. I think he set the tone for our family, and I'm very grateful and blessed that he does.
The amazing support that I've had by virtue of just sharing my illness with the community and with my co-workers, in a sense, has really encouraged me, and I think has helped me maintain my optimism and my belief that I will beat this.
Having cancer has given Mike a new perspective in regards to patients served at Fort Healthcare.
My own personal journey has obviously affected me significantly, and as I look at my job, it's less of a business, it's more of an aspect of caring, and I can place myself in some of the journeys that many of our patients are going through today. It's a much tighter connection that I have in terms of the mission of this organization, our strategic initiatives. I really see how it is touching and affecting the quality and lifestyle of people's lives. But I think I really get it now, having experienced and accessed these services as a patient.
Mike and his family took part in a recent walk fest with Tomorrow's Hope.
I think the Walk Fest was the culmination of what Tomorrow's Hope is all about. It epitomizes what it is we're trying to do in terms of touching lives. The feel, the support, the journeys all coming together and seeing people walk the torch and seeing how for a moment they maybe were able to put their life-limiting illness on hold or behind them and just saw the love, the support, the prayers, the concern. It certainly does give hope. There is a lot of reason to live and there's a lot of reason to fight through the disease process, and I think I really saw that it really put a face on what it is we're trying to do through Tomorrow's Hope.
With their positive attitude and future hopes, the Wallace family simply doesn't have time for cancer.
He sees this behind him. He sees it as he's through the treatments and he's well again. And that, I think, is what keeps us going.
You know, I want to see my kids graduate from high school. I want to see them graduate from college. I want to walk them down the aisle at their wedding. I want to hold my grandkids. And I want to do all that with my wife. So I have plenty of future and many things that I want to accomplish with my family, and I think also professionally. I really enjoy what I do, and there's a bright future at Ford Healthcare, and I want to be a part of that. I want to help lead that, and I want to help us position ourselves for an even brighter future.